So another ADR is the neuroleptic malignant syndrome. So the symptoms of the neuroleptic malignant syndrome are fever, leukocytosis, tremors, elevated CPK, and rigidity. So the clinical presentation of this condition is the fever more than 100 degree Fahrenheit, muscle rigidity, lead pipe in most severe form, altered mental status, drowsiness, agitation, confusion, delirium, and coma, autonomic instability, fluctuations in the BP, tachypnea, tachycardia, silaroia, diaphoresis, flushing, skin pallor, and incontinence. So what is the treatment of neuroleptic malignant syndrome? So that is, we can use the intravenous dantrolene, bromocriptine, and some other anticholinergic drugs. But it is actually in anticholinergics, there is not useful so much. So another symptom that is this dyskinesia. This is Parkinson. So as you can see, this is very much problem. This is this dyskinesia. What is this one? So treatment of Parkinson or this condition, one of the anticholinergic anti-Parkinsonian drug may be given concurrently. Example, risperidone and trihexyphenidyl. Another symptom is the acute dystonia, that is involuntary, sustained, painful muscular spasm. So what will you see in this condition?
It has to come and see you because there's a problem with the muscles in your neck. Can you just tell me what's happened and how it's come about?
Oh, it's probably, I don't know, 20 minutes ago, just started to give me injection or something.
Has it got any worse or you just stayed
So this is a conversation with a patient suffering with the spasmodic torticollis.
Can you move your head straight at all?
So this is the patient.
Okay. Carry on as much as you can. I'll give you something for it.
Unable to make movement
It's
properly.
okay. It's what's called dystonia.
So this is another one symptom, acute dystonic reaction. Mouth of the patient is actually
So
still open.
when did you start having trouble talking?
Patient is unable to close the jaw.
Early this morning? And did you take any drugs? Other than your prescribed drugs? No?
So what is the treatment of acute muscle dystonia? That would be central anticholinergics, injection of the promethazine or injection of hydroxygen we can be used. So this symptom is actually akathisia. Patient is continuously walking on the corridor or room. Continuous movements of the hand, there is also. This is akathisia. So first drug of choice is BZD, the benzodiazepines, that is diazepam can be chosen. Another one is the propranolol, and some central anticholinergic can also be used, like trihexyphenidyl.
Try not to be distracted by the movements in her lower
So
face.
there is another symptom.
Please focus your attention on her eyebrow.
So this is the another EPS, tardive dyskinesia. So so the treatment of this condition is a high dose of the neuroleptics. It can give temporarily relief, and no satisfactory solution we have till yet. The last one is the extrapyramidal symptoms. So Rabbit syndrome. Here you can see the lip movement of the patient. So it is exactly working as like rabbit. So this is Rabbit syndrome. Treatment of this is central anticholinergic drugs. Now we are going to proper talk about other first generation antipsychotics. So triflupromazine can be used as antiemetic, trifluperazine and fluphenazine. They have the high potency, less autonomic ADRs. They have the marked EPS. While the flupentixol have the less sedating than CPZ. The drug haloperidol, which is much more used now these days, it has the high potency, less autonomic ADR, preferred in the elderly. It is the drug of choice of acute schizophrenia, Huntington's disease, and Gilles de la Tourette syndrome. Trifluperidol, it is more potent than haloperidol. Second generation antipsychotics. These are newer first line of drugs, potent serotonin and weak dopamine D2 receptor blockage. It causes no EPS, no elevated prolactin level, suppress both positive and negative symptoms, effective in resistant cases of the psychosis. This is much better. Clozapine, it's a first atypical antipsychotics, potent 5-HT2A plus mainly D1, D4 and weak D2 receptor blocker. It causes low EPS. Also block alpha plus histamine H1 and muscarinic receptors. So ADR of clozapine are mainly agranulocytosis, sedation, hypotension, weight gain, diabetes mellitus, and epileptogenic. It is. So uses reserve drug in refractory schizophrenia. T-half of this drug is 12 hours. Olanzapine, very much used now these days. Potent 5-HT2A plus weak D2 receptors blockage it causes. Also block alpha 1 and alpha 2, histamine H1 and muscarinic receptors. Suppress both positive and negative symptoms. Potent anti-muscarinic drug. Adverse drug reactions are dry mouth, constipation, weight gain, rarely EPS, diabetes mellitus, use schizophrenia and bipolar disorders. Long T-half it has, so 24 to 30 hours. Quetiapine, better drug. Potent serotonin 5-HT1A, 5-HT2 and weak D2 receptor blocker. Also block the alpha 1, alpha 2, and H1 receptors. ADRs, sedation, hypotension, weight gain, diabetes mellitus, and rarely EPS. Uses of quetiapine, schizophrenia, and bipolar disorders. Long T half it has 6 hours. Risperidone, very fine drug now these days. Potent 5-HT2A plus D2 receptors blockers. Also block the alpha 1, alpha 2, H1 receptors. It has the to H1, it has high affinity. ADRs, postural hypotension. EPS are less only at low doses, less than 6 mg. Above the 6 mg, it can be possible. Weight gain and diabetes mellitus. Use in schizophrenia and other psychosis. Ziprasidone, potent 5-HT2A or 2C, and D2 receptor blocker. Also block alpha 1 and H1 receptors. It is antagonist at 5-HT1D and agonist at 5-HT1A, and potent inhibition of 5-HT and noradrenaline reuptake that result in anxiolytic and antidepressant effect. ADRs, no antimuscarinic effects, mild sedation, modest hypotension, less weight gain, diabetes mellitus, rarely EPS. Use schizophrenia and mania, long T half, 8 hours. Aripiprazole, it's a unique drug, partial agonist at 5-HT1A plus D2 receptors, antagonist at 5-HT2 receptors. ADRs, no antimuscarinic effect, no sedation, little tendency to weight gain, and diabetes mellitus. It causes rarely EPS and modest hypotension. Use schizophrenia and mania. Long T half, 3 days. Amisulpride, it has high affinity to D2, D3, and low affinity for 5-HT2 receptors. It improves negative symptoms of the schizophrenia. ADRs, insomnia, anxiety, agitation, few EPS, and less weight gain. T half is 12 hours. Zotapine, D1 plus D2, 5-HT2, alpha 1, H1 receptor blocker. Improves positive and negative symptoms. ADRs, few EPS but more than clozapine. Hyperprolactinemia, seizures and weight gain. Hyperglycemia, dyslipidemia, or clozapine, RS clozapine. T have 14 hours, it's actually banned in the UK. Loxapine, fast onset, short duration of action. Actions are as same to phenothiazines. Pimodazole, potent DA, dopamine, weak alpha and cholinergic receptor blocker. Low ANS, ADRs. Use psychosis and Tourette's syndrome. Reserpine depletes monoamines. ADRs, depression, no use as antipsychotic. Uses of antipsychotic drugs. So these are these antipsychotics can be used in the condition of in the disease of schizophrenia, mania, anti-anxiety, anti-emetic, hiccup, tetanus, and rarely used in alcoholic hallucinosis or Huntington's disease, Gilles-de la Tourette syndrome. So this is all about schizophrenia.